The presence of stone in our kidney is a common phenomenon. But what if I tell you that these kidney stones can become dangerous for a patient's life? My name is Dr. Puruthaman, and today let us try to see how and why our kidney get damaged because of presence of kidney stone. With this, I will be also talking to you about the way in which you can prevent damage being caused to your kidney. But before I actually start, it is vital for all of you to understand the basics of filtration system in the human body. We have demonstrated a small visual of a human kidney on the screen of this. Here you can see that whenever our kidney produces urine, it travels from these small vessels present on each side, where both are individually connected to each of our kidneys. These small pipes are connected to a larger one where this urine ultimately travels to and gets stored, which is called the urinary bladder. It is here where all the urine is stored till the time the individual does not pass it. This is a normal process of filtration that takes place in an individual. Now, if due to any reason we see that there is a stone formation happening in the kidneys, there are mainly two ways in which the damage can be caused. Firstly, let's talk about the obstruction in which the stone can actually block the narrow pipes which are responsible for carrying the urine from our kidney to the urinary bladder. Let me explain to you. The reason behind this obstruction, whenever an individual has stones in their kidneys, they are not stationary, which means they keep moving from one place to another. Due to this, the stone can actually accumulate at the mouth of these pipes, causing the obstruction. Now, what is happening here is that the urine is being produced in a usual manner, but it cannot travel to the urinary bladder where the problem arises. This obstruction can back pressure, which is known as PUJ obstruction in medical terms. The main issue that arises with this is that the nephron in the kidney keep on working in an environment filled with the toxic material. This is the one of the main reason why our kidney get damaged because of stones, which also pushes the creatinine and urea level to a greater extent. This condition is known as hydronephrosis, and this condition need surgical intervention. Now, if the size of the stone in the kidney is small, then there is a high chances of them passing naturally via urine on their own. But on the other hand, if the size of the kidney is big, I would recommend surgery. If we let the stone be where they are, the kidney will start to lose their functioning, which can turn permanent over the years if proper steps are not taken. Now, I know that all of you must have the same question in your mind: the stone of what size can pass naturally, where surgery would not be required? For this, let me tell you all that stone ranging between 6 to 7 mm in a male can pass naturally without surgery. But if the stone is bigger than the 7 mm, it will not be able to pass naturally. The reason behind is that the size of our ureter through which the urine travels ranges between the 4 to 5 mm, which can expand maximum to 7 mm and not beyond. The reason behind this is that the size of our ureter through which the urine travels ranges between 4 to 5 mm, which can expand maximum to 7 mm and not beyond that. This is the reason that stones which are smaller than the 7 mm are able to pass naturally. I hope everyone understood the first way in which stones can be reason behind the damage being caused to the kidneys. Apart from this, the calyx is the second place where we see the presence of stone in our kidneys. But the stone in which region do not cause any significant obstruction. If you try and understand calyx, it is a massive area in the kidney, and even if the multiple stone of 4 to 5 mm are present, they are not cause any kind of obstruction in the flow of urine. Also, the presence of stone in this region is very normal, as we see them in every second or third patient. The thing to understand here is that till there is no obstruction caused to the flow of the urine, there will be no symptom and no damage will be caused to the kidney. In case of the stone being present in the calyx, the problem only arises when the flow of the urine is obstructed due to any reason. Now I want everyone to pay a little attention to the screen. There can be at times when the size of the stone can be bigger than what the calyx can contain, which can actually obstruct the flow of urine, ultimately leading to the damaged kidney. Other than this, calyx does not cause any symptom or issue. I hope by now all of you have understood the way in which having stone can actually damage your kidney. Moving forward, I think it is time that I now talk about the solution of the issue I have discussed with you. It is very straightforward. Let me tell you. All of you have to do is keep a check on the size of the stone that are present in our kidney. If the size is below 7 mm, you can give yourself 2 weeks or a month and wait for them to pass naturally. But if the size exceeds 7 mm, I recommend getting your surgery done as soon as possible to avoid significant damage to the kidney. Sometimes I get patients who ask me question like, my previous doctor said that I should get my left kidney removed because it has low functioning. Before we get into this, I must tell you why the doctor is telling you this. A DTPA renal scan is used by doctors worldwide to check the percentage of which your kidney is working. For this scan, a special ink is passed through the patient's blood to check the time it takes to reach out our kidney. From there, a doctor then checked for the amount that has been passed and the time it takes for the ink to leave the body, which represent the filtration speed of the urine in the body. Now, if there is an obstruction wherein the urine is getting produced but it is unable to leave the kidney and reach the urinary bladder, the report will show that the kidney have a low functioning rate. But the only reason behind this is that the urine cannot get clearance from the kidneys, which leads to the reading being so low. Also, this indicates that the kidney are producing urine in a usual manner, which means that there is no actual problem in the functioning of the kidney. Now, it becomes crucial for us to clear out this stored toxic waste so that the kidney are not damaged. This is done with the help of a process known as DJ stunting. A teeny silicone pipe is put through the pipes which carries urine to the kidney. These silicone pipes bypass the blockage caused due to the stone reaching to the kidney, which ultimately leads to the flow of the urine being restored. Now, with this restored blood flow, what we see is that the functioning of the kidney improves and the creatinine and urea levels become down. So, I hope you have understood how the kidney stone affects the health of the kidney and why the level of creatinine and urea increases in a patient who are suffering from kidney stone. Now we have reached the end of today's video. I want to tell everyone not to get scared if you ever find your doctor telling you that you should get your kidney removed. I advise first to get BT done and see whether the condition and the functioning of the kidney improves. If it helps, then there is no need for you to get your kidney removed. I always tell my patient not to panic and try all the available ways before opting for something as significant as kidney removal. With this, I would like to end today's video by saying that you should always pay attention to the minor signs that your kidney might be giving you and maintain a healthy lifestyle. I will see you all in the next time with another exciting topic related to kidney health. Till then, take care and stay healthy. Bye-bye.